What you need to know about chronic yeast infections. Chronic yeast infections are common among women. In fact, 3 out of every 4 women with the yeast infection will continue to suffer from it each month. This is despite taking medications and making sure that proper hygiene is maintained. Yeast infection occurs when a naturally occurring fungus in the vagina, referred to as Candida albicans, multiplies rapidly. It becomes chronic when the symptoms persist even after taking medications. Women suffering from chronic yeast infection will develop the following signs and symptoms: vaginal itching, redness and swelling of the vulva, presence of thick white to yellow discharge, painful urination, and feeling pain during sexual intercourse. What are the causes of chronic yeast infections then? Here is a list of the known causes of yeast infection. If you have a weak immune system, chances are you are at risk to contract yeast infection. Yeast infections are also common among women who are diagnosed with HIV. Taking antibiotics for other medical conditions can also trigger Candida albicans infection. The body contains good bacteria. These are needed to maintain balance in your body. If you constantly take antibiotics, there is a risk of damaging the good bacteria in addition to the bad bacteria, leaving your body prone to developing infection. A lot of feminine hygiene products were released in the market. Using products with harsh chemicals or strong fragrances will cause the development of yeast infection. Poor feminine hygiene will also lead to incurring yeast infection. Doctors point out as well that stress also plays a major part in the overgrowth of Candida albicans. Poor eating habits are also among the possible causes of infection. Chronic infections are usually determined once a patient develops more than 3 yeast infections in just a span of 6 months. Usually, women who are suffering from chronic yeast infections take medications such as drugs or pills. Though yeast infection is not hard to treat, once the infection reaches a new level, such as when it becomes a full-blown chronic yeast infection, it will be quite difficult to treat, and the woman who gets infected will probably have to rely on lifelong treatment for the infection. Most doctors recommend vaginal tablets. Meanwhile, people who are too embarrassed to see a doctor will often resort to self-medication. However, once your body gets immune to the medication, it will lose its effectiveness in the long run, so it is important to find the treatment that is perfect for you. People who suspect they may have chronic yeast infections should consult a doctor for the proper and immediate treatment. Ever thought of curing your yeast infection permanently, once and for all? If so, visit www.cureyeastinfectionholistically.com for more free videos that will reveal to you a clinically researched system that will eliminate yeast infection for good.